Growth Hormone Deficiency Test, how diagnosis works and why you need to get a blood test through the Florida Summerlin Clinic. HGH deficiency is a significant issue which can have a substantial impact on your health and well-being. Most people don't even realize that they are suffering from HGH deficiency because many of the symptoms are merely mistaken for the natural aging process. We offer the opportunity for new patients to get blood tested anywhere in the United States to determine their hormone levels. The first thing required is for you to contact us through the information request box on the right-hand side of our website and let us know your city, state, and zip code. We can look up a LabCorp or Quest Diagnostic Center near you and schedule an appointment based on your availability and schedule. Every person has their own unique need for human growth hormone, and some people are more sensitive to its deficiency than others. There are 2 requirements that need to be met to qualify for bioidentical HGH or Hormone hormone replacement therapy. You must be clinically diagnosed with HGH deficiency. This is easy to test when you get your blood drawn at one of our affiliated blood draw centers, and your results will be securely and confidentially sent to us within less than 7 business days. Usually, about 4 to 5 business days is the norm. If your IGF-1 levels are low, the physicians at the Florida Summerlin Clinic may diagnose you with hypopituitarism. You must display symptoms of human growth hormone deficiency, which are having an impact on your health and well-being. There is a whole list of symptoms associated with HGH decline, and if you are experiencing any of these symptoms, you would be a good candidate for HGH or Hormone injections. Most people who contact us qualify for treatment. The Florida Summerlin Clinic understands that HGH decline, also known as somatopause, hypopituitarism, adult growth hormone deficiency, and andropause, is a significant health issue for adult men and women, and our clinic specializes in hormone balance, optimization, replenishment, and restoration. At the Florida Summerlin Clinic, we have the resources, experience, and logistical capabilities to provide you with a fast and accurate diagnosis for providing the analysis necessary to give you treatment with as little hassle as possible. We cut through the red tape and bureaucracy to help you make the whole process of determining your IGF-1 levels easy. The rest of this video will explain how the clinic makes something so complex, like HRT, seem so easy. The first step is contacting us. A confidential call. The first step to initiate your medical assessment for hormone replacement therapy is to contact us. There are multiple ways to do this. The easiest way is to just give us a call. We have clinical professionals on hand to take any call or answer any question that you might have. Our online confidential contact form. We also have a form on our website which you can fill out requesting your desire to seek hormone replacement therapy treatments. You only provide us with your name and phone number, and we will contact you at your earliest convenience. Make sure you give a valid phone number. Otherwise, there is no way we can contact you. Speak with a patient advisor, nurse, or physician to answer your questions. If you decide that you are interested in hormone replacement therapy, HRT, after spending some time on our website and would like to see if you qualify for treatment, we will arrange for one of our clinical physicians to take your call and go over any previous blood work you may have had done and talk about your familial and personal history of medical issues or concerns. We will be your caring guide for the remainder of diagnosis and treatment, and we will provide you with personal and professional guidance and care to ensure that you get the treatment that you deserve. We are thoughtful and conscientious when it comes to helping you determine the right dose and protocol you need to feel better again. We care very much about our new and existing patients. Your initial medical appointment. To provide you with a valid diagnosis, we will have to arrange for a rather routine physical. Although the Florida Summerlin Clinic provides its services remotely, we have affiliated physicians all across the nation in all 50 states that can offer the in-person or walk-in clinic appointment necessary. We offer telemedicine. If you don't want to fly down to Miami, we can offer you telemedicine. You don't even have to go to the doctor's office. The medical evaluation is so easy that we can arrange for the doctor to visit you. If you are too busy to make it out to the doctor's office locally, we would be more than happy to arrange for the physician to visit you at your home or office. If this is too intrusive, we can provide you with telemedicine, which means we can speak with you over the phone. We also have a physical clinic in Miami that you can visit. Come down to Miami and take a little vacation with our clinic, a place you can stop by to visit and spend time with us. We would like to get to know you, talk about your health goals, and tell you about our 3-month and 6-month Sermorelin acetate protocols. What to expect during your medical appointment. 1. Medical history. First, our affiliated physician will hand you a medical history form, in which you will provide information pertinent to your potential medical need for hormone replacement therapy. The form will also go over some mitigating circumstances which may prevent you from qualifying for treatment. Most people are eligible for treatment, so have no fears. 2. Physical. After you fill out your medical history form, the physician will give you a routine physical to assess your health condition. This will provide the clinic with more information regarding both your need for treatment and to look for any underlying conditions which may be causing you difficulties. The physical will also ensure that our clinical professionals at the Florida Sermorelin Clinic prescribe you the treatment and dosage which most effectively suits the needs and dimensions of your body. Your height, gender, weight, and age range will play an essential role in determining the proper dose you need. 3. Blood sample testing HGH levels. After you fill out your medical history and undergo your physical, you will then be required to provide a blood sample. This is the most critical part of your preliminary appointment, and your blood sample will provide us with the vital information we need to offer a fully informed diagnosis. You see, the way that we determine your need for therapy is by measuring the levels of particular hormones circulating through the bloodstream. We do not assess your need simply by just measuring your HGH levels alone. HGH is released quickly by the pituitary gland in small pulses, about 30 per day. These pulses circulate through the body in just a few minutes. Most of the HGH circulates through the liver, where it is converted into a hormone known as insulin-like growth factor 1, or IGF-1. This is the primary hormone, which will give us a glimpse of your underlying HGH balance. Although human growth hormone only remains in the bloodstream for a very brief period, IGF-1 remains in circulation for a few days, meaning that by measuring your relatively constant IGF-1 levels, we can infer your underlying HGH production as a result. After our affiliate physician draws your blood sample, your physical is complete, and we have everything that we need from you to make an informed diagnosis on your behalf. We have some of the best physicians in the nation who specialize in HGH sermorelin and testosterone cycles. HGH blood diagnostic testing. After your entire appointment is complete, our affiliate medical professional will mail your blood sample for evaluation. The Florida Sermorelin Clinic uses the nationally respected laboratory testing company, LabCorp, for almost all of our blood diagnostics. Founded in 1978, LabCorp has made a name for itself with its practical, reliable medical testing, and is used by medical professionals and businesses across the country. LabCorp will run a full hormone panel on your blood test, providing our clinical physicians an array of data with which to analyze your current medical condition and determine what it will take to give you hormone balance optimization. After LabCorp receives your blood sample, it sends the results directly to our office in just 3 to 5 business days. Saturday and Sunday do not count toward the days. Consider a 7-day turnaround the worst case scenario.